DJ Salvador lives with his 92-year-old grandmother who suffers from Alzheimer's, his father who is diabetic, and his mother who's had a stroke. The last thing he wanted to add into the mix was COVID-19. But working as a nurse meant that was always going to be a possibility.
Medyo natatakot ako noon.
I was afraid my family would get sick. If I got sick because I had direct exposure to employees and patients who were COVID positive.
His fears came true. He became a patient at the government hospital where he works. His father then tested positive for COVID-19, and his mother and grandmother showed symptoms.
Kasi ako yung health worker. Ako naman yung
I'm a health worker, so I'm pretty sure I am the one who brought the virus home. I blamed myself at the time.
Almost 6,500 nurses in the Philippines have contracted coronavirus. In the United States, a report last September said a third of 200 nurses there who died of COVID-19 were Filipino. Yet, many Filipinos still choose to work overseas. Filipino nurses are some of the most in demand in the world, but here in the Philippines, they're overworked, they're underpaid, and throughout the COVID-19 pandemic, they've had to beg for their risk pay and benefits. DJ was one of a handful of nurses who joined the May Day labor rights demonstrations. Not the first time nurses have taken to the streets to air their grievances.
Our nurses and health workers are already exhausted, severely exhausted, and we are demoralized because we feel that even though the government referred to us as the heroes in this pandemic, they do not really show genuine compassion and care to us.
The difficulty of claiming COVID-19 benefits has weighed on DJ's mind. He could find work in another country, but that would mean leaving his family behind. Barnaby, Al Jazeera, Manila.